collapsed foot arch and pelvic floor dysfunction actually go hand in hand. Hi, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. Let's review this for a second. I'm standing right next to my skeleton here, and I want you to focus on my own feet. In order for my feet the arch to collapse, which I don't have a collapsed arch, I can collapse it in order for me to do it, I have to turn my knee in. For people who have collapsed arch, their knees tend to be inward to begin with. So that means that you're biomechanically, where the thigh bone is connected to the pelvis, and now it is rotated inward, it is going to tighten things up here with the inner thigh, and it is going to create an imbalance with the connections of the inner thigh muscles being connected to this portion of the pelvis on both sides. So if something is tight and it's becoming shortened, it is going to create an imbalance on the inside of the pelvis and outside the pelvis. Now in this case, the inside, well, let's just say the pelvis is like a bowl with a vagina, penis, or penis that is, and anus being at the bottom. That's where the floor is, but the floor is not just by itself, it's connected to the walls of the pelvis, the muscles of the walls of the pelvis as well. So now with that collapsed arch, I am creating an imbalance in the inner thigh. I'm creating a tightness and imbalance in some muscles of the pelvic floor, some muscles on the inside of the pelvis. I am creating a chaos. So collapsed arch, if you have it, you have pelvic floor dysfunction. That does not mean you have incontinence, but you're more susceptible to have it down the road, and you definitely have biomechanical alterations which directly impact the stability of your pelvis. Without proper stability of the pelvis, you have all the symptoms, subtle or not so subtle symptoms of pelvic floor dysfunction. If this makes sense to you, then addressing the stability of the pelvis comes before anything else. And that is not something that happens with an internal manual work. It's something that has to happen globally, meaning your whole body movement is involved. Don't feel frustrated because, oh my gosh, this problem is much bigger. Look at it as this being the reason why going forward, once you do proper treatment, when you have proper biomechanics and movement, then your future with regards to other parts of your body, movement-wise speaking, is much brighter. So we're talking about the same treatment will be true for, or will be better for sacroiliac joint problems back here, problems with lower back issues, problems with hips, knees, feet, you just name it, overall postural improvement. So that's a whole different video, but I just wanted to bring to your attention the fact that everything is related, and the arch of your feet play a huge role with your pelvic stability and presence or absence of pelvic floor dysfunction. Hope this helped.